Thank you, Zachary. Now we are going to continue with the presentation by Pablo González. He comes from Chile. He works in the UNDP. He's coordinator of the National Report on Human Development of Chile, and he's associate investigator of the Applied Economics Center and the Advanced Research Center of Education of the Chile University. He has participated in different committees and commissions related to the first childhood and education at different levels. Pablo González has a PhD in economics from Cambridge, and he is a commercial engineering, as economists say in Chile, from the Catholic University of Chile. Good afternoon. Thanks to the organizers, especially Mariano, Ricardo. Can you hear me? And all of you for being here at this hour. Can you hear me now? I have the hard task of summarizing in 15 minutes 300 pages plus an appendix. So I'll try to focus on 3 core messages that have not been mentioned regarding public policies. This report begins with 2 central issues for Chile in 2012. On one hand, there's a political and academic discussion taking place internationally, and this seminar forms part of this regarding the goals of development. And this is not covered by GDP. This is a discussion that started in the 90s. And basically, the message is to consider other dimensions beyond the income and standards of life. In Chile and in the world, there are different events that also, well, even Time chose as character of the year this person. So there were different expressions of being upset with this. What do they have in common? Well, it's necessary now more than ever to incorporate the subjectivity in the development. And from the political standpoint, one of our main proposals is to incorporate a broader vision of subjectivity. And this broader vision is not only about the concept of happiness that we're using and the individual subjective well-being is how people assess their own lives. We consider that subjectivity is an assessment that the individuals make of themselves and their lives, the experience of their own lives, but also an experience and an assessment of the society in which they live. To what extent the society allows them to be who they want to be. And this subjective well-being that should be comprehensive includes 2 things. And in Chile, for instance, they are different. The percentage of people satisfied or very satisfied with their lives, the blue line, shows that over the years, it has, well, the satisfaction of people has increased and the happiness as well. But at the same time, what measure we propose with subjective well-being with society, the percentage of people who trust institution keeps deteriorating over time. Therefore, we propose, this is my first point, a measure of subjective well-being that incorporates social variables, the assessment people make regarding society. So this here I show you that the objective well-being predominates in the lower axis, in society axis. They include GDP, unemployment, poverty, life expectancy, but in fact, In the higher domain, on the left, we see the individual objective well-being, and now the discussion on happiness is placing that axis, the upper axis on the right. And also with measures of lack of individual satisfaction. What we propose is to cover the lower space, the social subjective well-being. And the second point is that this can be done, as Orwell was saying, we cannot intervene directly. We have to intervene through work on the space. That's why we are trying to conciliate human development with social well-being through the increase in the capacities, the real freedoms of people to pursue their life projects. And this includes both the individual and collective realms. And this might lead us to produce subjective well-being or other things that people value, because not all the people want necessarily to be happy as a single objective. What are these capacities? From a review of the literature specialized in these topics, we deliberated with different social groups in Chile to propose the list, and they told us back what they consider valuable. And this exercise produced this list of capacities: to have good health, to have physical and basic material needs covered, and other less traditional, like having important bonds, being respected in your rights, understand the world you live in, that's related to education, to feel safe and threat-free. Well, you can read the list of capacities. And what we found is that when we measure this through a survey, through different qualitative methods, we saw different measures of objective and subjective well-being with society. Individually, we found the variables most affected by public policies, basic needs, health, but we also found variables that in general are not observed, are not considered by the policies, such as having a life project, have important bonds, and be respected in your dignity and rights. And the social distribution of the capacities, of non-material capacities, the ones that are not traditionally observed, are not equally distributed in the society. If you go to the ABC1 group, which is the 8% wealthiest one of the population, if you made the general balance of your health, could you say that your health is very good, 79% says that. Group E, one of the most popular group, 34% say it's very good or good. How defined would you say is your life project and your personal goals for the future in the richest group? 87% say they do have defined this. In Group E, almost half consider they don't have a life project. They are concerned about everyday issues to solve their basic needs. Regarding significant bonds, there are several variables that compose the indicator of bonds. One of the questions is, do I frequently feel alone? 14% of the wealthiest group feels alone. 42% of the sector E frequently feels alone. And 44% say they do not have friends, against only 5% of the wealthiest group. Regarding subjective well-being, the two most important variables are respect, that include variables such as how they perceive society regarding their own dignity, or how they have been discriminated or suffered disrespect in different places, and also human safety. Regarding respect, we saw, I feel that in this society they respect dignity and rights of people like me. It was transversally answered with yes. In C1, ABC1, 46% think that the Chilean society do not respect the dignity and rights of people like them, and this increases to 63% in the other groups, like D and E. So there's a transversal perception of disrespect. What is unequally distributed is the perception to succeed if the person are mistreated. The group ABC1, 86% think they will succeed if they are mistreated and they claim, and only 40% of the group E. Human safety is the other variable. Is composed by a battery of 11 questions, of which I've selected some that show the dimensions of the index. In health, the confidence about paying the cost not covered by the health system before a serious disease, well, they still distrust this. In 97, 18%, and in 2011, 30%. Regarding employment, the difficulty to find a job, if you lose it or you abandon the current one, it's very difficult or difficult. 30% in 97 and 60% in 2011. It has improved, but almost two-thirds of the population think it would be difficult to find a job if they get fired. Citizen safety, the probability that you or someone in your household may suffer a robbery or an attempt of being robbed in a public space, it's 79 and then 80%. And provision, what they are going to receive when they are elder, 76% in 97 thought they would only have money to cover their basic needs. This has improved somehow. Two-thirds of the population think that they only will be able to afford it. So there's a strong subjective perception in the Chilean society. Some of the uses for this, I want to show you this map. This is a cluster analysis, conglomerates, in which, or clusters, we may classify the Chileans in different groups. In general, what we have in Chile is a perception, maybe the headline could be happy but upset. In general, the indicators have like a red flag. I mean, they are not approved from between 1 and 7 is less than 4. And the majority are those who are not satisfied. It's very strong in the middle classes. They have a high satisfaction level with their lives, but they are upset as a society. And this has been seen in the streets with the demonstrations that are reactivating this year. It's very strong in the city. Almost 40% of the population in the great cities is in this category. And these are people who have a good opinion of their life, 8.3. But they are upset with the society they live in, upset with the opportunities. They do not trust the institutions, and these persons in general feel that their dignity and rights are not respected.
I could describe the other groups, but they're asking me to fast forward a bit. That was just the initial description of context. So it's the saying that on public policies that, well, basically we have a proposal and we follow a bit what other countries have done, and this serves to give a basis to our proposal. And well, there's here are some of the positive arguments, some are negative. Other speakers have mentioned them, but there's a series of open questions. We've advanced in measuring them, but we haven't answered them totally. For instance, how much weight should we give to subjective well-being with regards to other measurable indexes? What should policies attend? We say capabilities. With what tools, what variables determine subjective well-being, and which are easiest to affect through policy? So what policies are most cost-effective in terms of subjective well-being. We can, if we're very simplistic, we have 4 positions what have been expressed today. One, which we could call a utilitarian position, which is very strong in neoclassical economics, which says that happiness is the ultimate goal, and government should therefore try and promote. The other one is paternalist libertarianism, in which the government should correct the systematic mistakes that allow individuals to maximize happiness. There's also a deliberationist one, which recognizes that there are several valuable objectives, and one of them is subjective well-being, and this position gives highlights politics. So and in this sense, you should also ask people what they consider most important, and then you make decisions. So these reports I'm presenting also only serve the interests of politics, and are an invitation to creating a policy. And while there's a fourth, which is reticent, which rejects and says, okay, we have the GDP, we know how we should act with our macroeconomic policy and valuables, we know how we need to how to stabilize the GDP, so let's only focus on the GDP. These are, in very simple terms, the 4 positions. What has been done on the issue of subjective well-being? Well, we've worked on individual subjective well-being, and we've worked on public policy, but we've realized that the report only has, well, it's only a 5-page report, so we had a public policy. There's a part that says that this research is still in its very early stages. So the report for human development recovers several experiences, and they use subjective well-being as a starting point, and there's a political leadership that's necessary to overcome the tendency to the status quo of government, and they incorporate subjective well-being as a complementary objective, not as the main objective. Even when we speak of gross happiness, there are 33 indicators, one of which is well-being. And there's also strong leadership in terms of health and local governments. Health, you have prevention, and that's an important thing to mention. Our proposal, and this would be the 3rd point I want to mention today. Well, we propose 2 main criteria for working on this issue. The first one has to do with incorporating logic for subjective well-being into all policies. In the United Kingdom, they've spoken of including happiness at the same level with health and exercise and such, because everything can have an impact on health, and everything can have an impact on subjective well-being, and it has an impact on this. So the proposal is that we cannot continue to be oblivious to this impact. We should try to face it and quantify it and estimate it explicitly, and this can change our decision-making in terms of policies. So by taking the design criteria for the implementation of our processes, we should include well-being and making sure that it's relevant to each culture and society. Regarding the second point, something that's also important is that we discuss what's valuable. We shouldn't continue technocratically deciding what's valuable for people. We should ask the people what's valuable for them and make the decision afterwards. So we should deliberate on this. Third point, we should focus on subjective life processes for people, multi-sectorial work, local work, try to help it or make it converge into a life project and to work through what we call appropriation conditions and scenarios in which subjectivity appropriates itself of this information. So it's important for policies to make sense for people in their everyday life and projects, and that the opportunities that have been created are for them, and that afterwards they will be able to conduct this in social scenarios in which they will be able to use these new capabilities. And regarding the first thing we mentioned, well, we're in our early stages, so we need to implement this at the social level, and we need the involvement of the stakeholders in these policies for feedback. And another important criteria is that policies should work policy should work on well-being. For instance, respect. We need to create rules that effectively allow us to avoid discrimination. We need to work in terms of culture. We need to work in terms of how people get along together socially, and otherwise we will not be able to attend issues pertaining to respect in society. And well, finally, subjectivity, and this, well, it's perhaps fashionable right now in terms of policy, and political systems need to adapt to this without losing their long-term vision. It's giving short-term solutions is a tendency in politics. So in the case of Chile, there's a demand for dignity, for a way in which we relate differently in terms of respect or other forms of relationship. If politics relates to this, this will change institutions. Otherwise, there might be risks. Thank you. And finally, just a joke. Oh, it's up here. It says, "I'm going to the market. Don't open the door to anybody." Mom, and what about if it's happiness? Okay, well, thank you for the final note, for the entire presentation, of course. So let's continue. It's 2:25. I see the tired faces, but next we have a presentation on the Italian experience with subjective well-being as a tool for public policy, and it will be given by Saverio Gazzelloni, who is the Director of Social, Demographic, and Environmental Statistics at ISTAT, the National Institute for Statistics of Italy. Before this, he was the Director of the National Statistical System, and he worked with a multi-purpose social surveys and the labor force surveys. He's worked for different groups with Eurostat as the head for cultural statistics. In the last 2 years, he has been involved in the BES project. I don't know what that stands for. Which aims to measure equitable and sustainable well-being.
Okay, good morning to everybody, and first of all, thanks very much to INEGI and Flaxo for invitation to a so interesting international seminar. I'll try to go very, very fast because the time is a little. I don't speak of this, already done by our colleague Roberto Castellanos, but this is the context. This is the context for the starting point of Italian project on the BES. BES stay for equitable and sustainable well-being. In Italian is benessere, equo e sostenibile, and this is BES. In 2010, ISTAT started with this shared initiative along with CNEL, and CNEL is a very important institution in Italy, is the Economic and Labor National Committee. That is the space, the institution where we met all representatives from policy, from union, from civil society, and so on. And this is one of the basic points of our Italian project. Well-being for Italy is a multidimensional analysis of significant aspects of citizen life quality. Equitable is because we have to pay big attention to the distribution aspect of the well-being, and sustainable because we have to assure the same condition for the next generation. This is the basic meaning of BES. I speak of this. We believe that the equity dimension, equitable dimension, is very, very important because we can have in some domains, in some dimension, something that improve, but while we measure improvement for a dimension, in the same dimension we can also register and improve an increasing of different distribution among social groups. And so we have to consider together the distribution elements with the level of well-being indicator. Obviously, this is a more complex way to look at well-being, but we decided to consider distribution factors within the building of the well-being indicators. Similarly, sustainability is the third pillar of our indicators, of our concept of well-being, because in the same terms we have to measure something that is important not only for the generation that is here and now, but also something that is very important to preserve, to maintain for the next generation. In this period, there is a very important task force between Eurostat, OECD, and UNECE, Union at the European level, that is producing a fast report on sustainability, and the main concept is around these three pillars. Here and now, we need sustainability, but also we need sustainability here and elsewhere, because we have transnational problems in order to ensure sustainability, and also, finally, here and in the future. This is the general framework. The key factor of the Italian experience, I believe, is this. The project was a very, very shared project. We are working on BES from 1 year and a half, about now 2 years. But the most important aspect of this project, I believe, is that it was built on a complex deliberative process and shared process. This process was organized on 3 main factors: a steering committee, a scientific commission, and a public consultation. The relationship between these 3 pillars is the main aspect for Italian project. In the steering committee, we have experts, scientific experts. In the scientific commission, we had about 80 scientific people coming from academia, coming from our National Statistical Institute, while in CNEL, in the National Committee for the Economy and Labor, there was about 33 stakeholders. You can see that there were entrepreneurs, unions, networks of consumers, environmental organizations, and so on. And in the meanwhile, we organized national survey, online survey, blog, and regional meetings. This is a very important aspect, and this is the flow chart of the organizational framework in order to build our Italian project on well-being. I want only to stress that, as you can see, this was a circular process, not a linear process before the committee, after the scientific commission, and after people. No, we manage this process taking into account all these points for 1 year and a half altogether, because there was a big discussion in the steering committee, but about at the same time we started with a scientific commission in order to define the indicators, because the main goals of the steering committee was to define what are the main dimension in order to define what is well-being in Italy. And the main goals, the mandate of the scientific commission was to define what indicators can measure that dimension. But I repeat, this was a circular exercise. One of the input, as you can see, was also a public consultation. We have inserted in our multi-purpose surveys in the 2011 year some question in order to register from population what were the key elements of well-being, and the word in bold shows what are the main dimensions for people we have to consider in order to build our indicators. After this period, we define this general framework. I underline that this is an important point for the project, because these 12 dimensions are shared dimensions, and this is a very important point. It is not only a scientific exercise, but this is an outcome on a large and complex debate between scientific academia, National Statistical Institute, and policymakers. So these 12 dimensions are very, very important for our project. About this, I like to underline some notation, some remark on this, because first consideration, we believe that it's very, very hard, perhaps it's not possible, to build a general framework on well-being that is equal for many countries. We came from our official statistical experience, and we know what is the importance of standardization, harmonization, and so on. And generally, we work on the harmonized definition, classification, indicators, and so on. In the BES project, I believe that 75–80% of indicators are international indicators, and they are comparable indicators. But the big problem is the synthesis of the dimension, because the synthesis of the dimension came from a shared process with policymakers, with citizens, and we believe that is something of specific country by country. We believe that there are many, many similar points between this general framework, between the GDP and beyond schemes and so on, OX schemes and so on, and also in front of the other general framework we have seen in other presentation. But we believe also that there are something specific for each country. For example, the dimension landscape and cultural heritage was something that was was discussed in a very complex way in the steering committee, because there was not a general framework of indicators in so particular domains. But after many discussions, we decided to include this, because this is something that has a strong relationship also with our constitutional law. That is the basic of our democracy. And after this discussion, we introduced the dimension of landscape and cultural heritage, and the scientific commission started to work in order to produce very new indicators. It was not simple, I assure, but we started with this new and very exciting exercise. Other remark on this slide is the dimension of subjective well-being. That is the key point of this seminar, obviously. We include these domains in the general framework. It is not our intention to manage subjective well-being indicators in an autonomous way out of the general framework of the general equitable and sustainable well-being. For us, the subjective well-being indicator is something that has strong relationship with all the other indicators. For this dimension, we define three basic indicators, that is satisfaction for life in general, satisfaction for leisure, and number of people who believe that their situation can improve in the next future. But if this is the specific domain of subjective well-being, we have included in each of the other domains a lot of indicators on subjective perception of well-being. So, for example, in dimension of work and life balance, we introduce 5 or 6 indicators, subjective indicators, and so for the other domains. This is the general framework of the BES. I already speak of this. Some indicators are completely new and innovative. This is the actual point of the project. I believe you cannot see, but this is the list. This is the list of 134 indicators, domain by domain, and we are able to produce figures on each indicators. And at this time, at this stadium of the project, we can also produce for about 80% of the indicators also their strengths, and this is very important factors. But we know that we have not finished our project because this is only a step of the project, and there are big challenges that we have to face. First of all, I underlined that the broad discussion is a key point of a project of this kind. Without steering committee in CNEL, I believe we were not able to produce nothing, because this policy dimension is a very, very important dimension. Actually, we are observing that there is also an increasing interest at the local level. And this framework indicators is important also for National Statistical Institute. We have included many of these indicators in our questionnaire, in our official surveys. I completely agree with OECD indication that the statistical office can produce very good subjective indicators and other objective indicators. We are putting subjective indicators in our general questionnaire from many years, and we can observe that we are able to produce consistency between indicators and good historical series. This is a good result. But we have to do a big work. We are only at 50% of the work. We have to work on the composite indicators by domain. We have to work on the equitable indicators by domain, but in addition, we have to reflect on the possibility to produce some composite indicators on the distributional aspect. And this is something of very new. We have studied, there is not a big international literature in this, but we have to try to do something in this. The last challenge is a big challenge because the sustainable theoretical framework is very, very complex. And we have also produced not only sustainable indicators, but also indicators that show something about the relationship between the different domains. So we have to study sustainable well-being between and within domains. I believe this is the challenge for the future. I don't know if I have time to go in detail, but this is the first challenge. We have to produce a detailed methodological work to assess the possibility of design composite indicator for the BESS. The second challenge is to produce something new about equity and sustainability. About this last question on sustainability, we have to produce something new. We are studying literature, we are studying different approach, but we have problem on this, and it is not very easy. We are trying to generalize a risk approach that we have studied in the health domain to the other domain, because the general used capital approach is a good approach for natural capital, for environmental capital. It is not clear for human capital, but it is very, very hard, and we need more definition, more classification, for example, for social capital. So we are not able to define sustainability using only the capital approach, but we have the need to integrate the capital approach with the risk approach. This is the first idea we are following in this period. So we have to build again the scientific commission for the next 2 years. We have to build again a steering committee for the next 2 years, because we believe that also the methodological aspect we have to face, we have to resolve them with the policy part. We cannot discuss, for example, of composite indicators without a public consultation with the policy stakeholders and with the civil society representatives. If we have to weight the indicators in our technique synthesis, we have to discuss what is the best way to weight indicators by indicators, also with the steering committee and not only with the scientific commission. This is the complexity of the project. This is the key challenge also discussed in this seminar. We want to use BESS for policy making, and we are imagining many initiatives in this case. In the 11th of March, we presented the first BESS report to our parliament, to our Republic President, and we are organizing the work in order to include BESS indicators in all parliamentary commission, because in Italy the commission of parliament are the specific institution that can use the indication coming from our project. In other words, our aim is to make the BESS crucial tool for the functioning of national institutions. Meanwhile, we have important signals. BESS is something that is interesting for city-level project. In this period, there is a big interest coming from the municipalities in order to develop BESS at local level, and so we are working to define a new framework, because it is not possible to produce the same indicators at local level that we are able to produce at national level, and this stimulated a big and complex discussion with municipality level actors, and this is something of new for the general Italian landscape. Thank you very much.